Hi, welcome to a new series of clinical case discussion. So, here in this video, we're going to see the basic introduction to case sheet writing. Okay, so the first one is at the outset, I'd like to tell the order of approach to any clinical case should never be breached. It should be followed in an order like first we should take history, we need to ask certain questions and we need to derive some information. Then we need to proceed with clinical examination. Then at the last, we'll go for management. Okay, so this order should never be breached. So the first one is history taking. Again, the case sheet can be divided into three subdivisions. Like first one is history taking, then general examination, then local examination with the provisional diagnosis. Right? So first one is patient details. So what are the basic patient details we are going to have? One is name, age, gender, address, occupation. So you know the basic importance because there are certain age related disorders in surgery, and also there are certain more diseases which are common in male gender. Likewise, it is the same in case of female gender. Then address is important. One is for communication, second one is there are certain endemic disorders, like for example goiter. So like that, there are certain endemic disorders we need to have on our mind whenever we are dealing with this address of the patient. And occupation is very important because there are certain occupation related disorders. Let's say for example, you can have varicose veins in case of prolonged standing, right? So wherever there is more radiation exposure, there is more chance of developing cancers or even goiter also. Okay, so like that, it is important. Then second one is chief complaints. Again, whenever we are writing the chief complaints, we need to go in an order. So let's say for example, the patient has presented with swelling in the front of the neck, swelling since 1 year, but the pain started somewhere around 2 weeks. So then you can mention pain since 1 week. So it should be in a chronological order. Okay, right? Next. Another important thing is whenever we are writing this patient details, we need to understand, even though we are writing on the paper with specific side headings, when we are describing the case, it should be like a story. Let's say, for example, a 36 years lady who is a homemaker residing at Tirupati came to surgical OPD Government General Hospital with the chief complaints of swelling in the front of neck for the past 1 year and pain in the swelling for the past 1 week. The patient was apparently all right 1 year back, and then she noticed a small swelling in the front of her neck, which is of insidious onset, gradually progressed in size. Initially, it was painless to begin with, but from the past 1 week, she noticed she is having pain in the swelling. Like that, whenever we are describing the main things, we need to present it in the form of a paragraph. Okay, right. So, after the chief complaints, then we are expanding this chief complaint by asking certain questions to the patient. So, that is nothing but your history of present illness. Okay, so history of present illness is nothing but we are asking certain questions to the patient to know more about that presenting complaint. So, what are the basic things? You can easily subcategorize this history of presenting illness into three subdivisions, right? For example, first one is history related to the presenting complaint and the system involved. So, let's say, for example, the patient presented with a swelling in the parotid region. So, you can go on asking regarding the main parotid swelling, like parotid gland, whatever the questions related to the particular uh, parotid gland swellings related questions. Then, next is for any case, you need to understand what happens if you don't treat that particular condition. Either the patient doesn't come or if it is left as such, then you can have certain sequel. So they are nothing but your complications. You need to ask history related to that particular complications. Then whatever the presenting complaint, there will be certain causes for that presenting complaints. So you need to ask etiology of that differential diagnosis, whatever we think related to those particular presenting complaints. Okay, so this is the three main subheadings in case of history of present illness. Right. Next is past history. Again, just like history of present illness, we are having three subdivisions here. One is history of similar complaints in the past. Second one is medical history. Then is your surgical history. Medical history is nothing but mainly we are asking about the comorbidities of the patient. So one is diabetes mellitus, hypertension, tuberculosis, asthma, epilepsy, stroke. Again, the stroke is important in few conditions, not in all conditions. Then you need to ask whether there has been any history of prior surgeries. Any history of prior surgeries. It can be related to the presenting complaint or the site where the presenting ailment is present, or it can be somewhere else. Okay, so any history of prior surgeries. So let's have an overview why we should ask this medical history. Like why should we bother about diabetes, hypertension, etc., etc. So you know that diabetes is very important. Whenever you, let's say for example, in surgery, whenever you take up a patient for surgery without controlling the diabetes mellitus, there can be so many sequelae which are happening. And regarding the surgery, you need to understand whenever there is uncontrolled diabetes, it can lead to poor or delayed wound healing. It can lead to poor or delayed wound healing. Then another one is it can also lead to an important condition called surgical site infection. Like that, there are so many important complications that we are worried about if there is no proper control of diabetes, right? Then, why is it important to ask about tuberculosis or asthma? You know, basically, there are two types of anesthesia under which surgeries are done. One is mainly general anesthesia, second one is spinal anesthesia. Whatever the condition where we need to go for a major surgery at or below the level of epigastrium, usually it is done under spinal anesthesia if everything is good. Or if it is something like a major surgery in case of abdominal operations, etc., even though the surgery is below the epigastrium, we will go for general anesthesia. So any major surgery at or above the level of epigastrium, let's say for example, a parotid swelling, parotidectomy, thyroidectomy, mastectomy, like that, these kind of a major operations at or above level of epigastrium, usually they are done under general anesthesia. To give general anesthesia, the respiratory system should be good. So if the patient is having any tuberculosis or asthma, they're related to your respiratory system, right? So whenever these things are present, we need to look into the anesthetist perspective to go for the anesthesia. So that is why these are very important. And moreover, whenever there is tuberculosis, you know it is a immunosuppressive state. So again, you need to consider this whenever you are planning treatment or for the for something else. Okay, so it is a state of immunosuppression. Then next is stroke. Again, stroke is related or important more in case of, let's say, for example, whenever a patient is presenting with peripheral arterial occlusive disease. So, in like that, in certain conditions, it is very important to ask about history of stroke. It can be brain stroke, nothing but your CVA, and heart stroke. Obviously, you cannot use your technical terms in history till you finish your summary of the history. You cannot use technical terms. Till there, we need to use only terminologies in case of patient view or general terminology. So you need to use the word stroke. Then, how is it important to ask about hypertension then? Why is it important in surgical patients? So let's look here. Whenever there is uncontrolled hypertension, what are the important sequelae we are worried about as surgeon? So, whenever there is uncontrolled hypertension, one, it can lead to intraoperatively increased risk of hemorrhage. Increased risk of bleeding will be there during the surgery. Second one is, basically, what happens if you take up a patient of uncontrolled hypertension to surgery? Whenever there is hypertension, you know that BP is equal to cardiac output into peripheral vascular resistance. So whenever there is increase in BP, so mainly the cardiac output will be changed and there will be increase in peripheral vascular resistance. So whenever there is increase in peripheral vascular resistance, what happens? Left ventricular hypertrophy occurs. Whenever there is left ventricular hypertrophy, at one point of time, this ventricle thinning may also happen, and there is more risk of intraoperative MI. So, this is another sequelae we are worried about, intraoperative MI. And next one is whenever there is left ventricular hypertrophy and the back pressure changes are happening in the mitral valve, obviously this acts as a source of embolism. So what happens whenever there is embolus happening within the heart? This can dislodge and cause thrombosis. So thrombus, basically first it is causing thrombus, and this thrombus will embolize, and this embolize can lead to stroke. What stroke? Let's say for example CVA. So these are the main complications we are worried about in patients with uncontrolled hypertension before we take up them for surgery. Okay, right. Next, family history. Again, whenever we are talking about family history, you need to understand whatever the relevant things in relation to the family history we need to tell. For example, if it is something like a oral cavity lesion or parotid or thyroid, in such condition you need to go for any head and neck cancers in the other family members. Okay. So in case of thyroid, one important thing we need to ask is any head and neck cancer. Whenever we are dealing with the breast, we need to ask about BRCA related cancers. So it is more important in case of breast lump. Like that, it depends on the case. Depending upon the case, whatever that is relevant to us, that only will be asked. Okay, right. Next, coming to the personal history. Again, personal history. What are the main things? One is type of diet. How is type of diet important? It is mainly important in case of, let's say, for example, thyroid case. So we need to ask specifically whether the patient is taking more of Brassicaceae family. And again, there are certain other things we need to ask regarding diet, whether patient is purely vegetarian or not, or it's a mixed type of diet, etc., etc. We will see in each respective case discussions. Right. Next, appetite. So you need to understand there are certain aspects of appetite that are more important. One is wherever there is loss of appetite. One is malignancy. So malignancy you can have loss of appetite. But before malignancy, another important condition is TB. Okay. So in tuberculosis also there will be loss of appetite. Regarding thyroid and appetite, there are certain aspects that we need to remember. We will look into them in thyroid case discussion. So at least remember where is appetite loss means main important condition is tuberculosis and malignancy. Okay, right. Next, sleep pattern. There are certain conditions where sleep pattern is disturbed. Let's say, for example, peripheral artery occlusive disease. In case of severe disease, there will be severe pain. Patient will not be able to sleep because of the pain. And also in case of surgical jaundice. What happens in surgical jaundice? Because of the deposition of bile salts in the under beneath the skin, there will be severe itching. Because of that severe itching, also patient may not be able to sleep properly. Then bowel and bladder habits. We need to tell whether the patient is having any problems related to constipation or if there is any micturition problems, etc. Again, it is more of something like a individual case based things. Right. Next, addictions. So we need to ask about smoking, alcohol, and betel nut chewing. Again, it is related to, like, in few important cases, it is very important. So one is obviously thyroid, another one is oral cavity lesion or oral cavity ulcerative lesion. Right now, why are we more worried about smoking? Alcohol is something like it happens, it leads to many sequelae in the body. It is more important and it is more comprehensively given in medicine. So, how is it important for us? This smoking, you need to understand. So, mainly, smoking contains three most important things. So, you can remember them H, C, N. Okay, so H for hydrogen cyanide, C for carbon monoxide, N for nicotine. Okay, in general, smoking is very bad in such that it can cause any COPD or any respiratory system disorders. Also, smoking will delay the wound healing. How does smoking delay wound healing? It will impair collagen synthesis. So smoking inhibits collagen synthesis. Okay. Then So smoking contains these three important substances. You know, nicotine is a very potent vasoconstrictor. So also it will lead to sympathetic stimulation. So this sympathetic stimulation along with vasoconstriction is more important in case of PVD, peripheral vascular disease. Okay, right. You know, carbon monoxide has got 300 times more potency to bind with the hemoglobin to form carboxyhemoglobin, which is bad. Then this cyanide component is very, very, very important in case of again thyroid case. How is it important and all? We will see in case of thyroid case discussion. Okay, right. Next. Again, after personal history, there are certain things which, if relevant, and if the patient is female, we will ask and we need to document them. So, one is menstrual history, marital history. So, menstrual history, you know that it is more important in case of thyroid swelling and breast lump. So, these are the basic things we will be asking. So, age at menarche, how many cycles per month, and if there are any menstrual disturbances, and if the patient is elderly lady, we need to ask about menopause, etc. Okay, then marital history, it is more important again in case of thyroid and breast lump. So you know, we will be asking about age at marriage, first child at which age of the patient, then if there is infertility, whether there has been any treatment taken, and how is breastfeeding given to babies for how many months, etc. It is more important in case of breast lump, and whether there is any history of miscarriages. Again, it is more important in case of thyroid or even breast lump. Okay, right. Next. So others, we need to ask whether the patient has gone to any other local doctor. Sometimes patient will visit some quacks, and some intervention has already been done. So we need to ask whether there has been any treatment taken for the presenting complaint or presenting condition. You need to ask it, and you need to ask about that and document it. Then whether there is any history of allergy. Then lastly, at the end of the history, you need to summarize the case only with the positive findings. Okay, so whatever the positive findings that you have in the history, you need to summarize it in the form of a paragraph. Okay, right. Next, after the history, we need to go for general examination. So we will be looking at consciousness level of the patient, coherence, whether the patient is cooperative or not, and whether the patient is oriented to time, place, person. How is the build of the patient? Then nourishment. Then the basic things like pallor, icterus, cyanosis, clubbing, generalized lymphadenopathy, and the other one is bilateral pedal edema. Please understand, it is bilateral pedal edema. Then you will go for vital data. Again, in data, you need to remember we will go in a certain sequence. So first one is temperature, then pulse rate, then blood pressure, then lastly respiratory rate. Then in general examination, we need to look at the patient top to bottom, head to toe, and if there are any specific findings to our case, you need to mention them. Right? Next. So after general examination, we will be going for local examination. You know that the age, like the classical inspection, palpation, percussion, and auscultation will be there. All the four things may not be applicable for all the cases. Let's say, for example, whenever you have any surface swelling, only inspection and palpation are more important. So percussion and auscultation do not have any role in those cases. Like that, it depends on the case. What are all the headings that are applicable and what we need to examine and document it. Right. Next. So the next one is systemic examination. Again, it depends on case, like what are all the important things we will be saying is whether the first and second heart sounds are present or not, and whether there are any murmurs present. Like that, these are the important things in CVS. Then whether the bilateral air entry is equal, and how what are the types of breath sounds we are having. So normal, vesicular breath sounds, if it is something like bilateral. Then per abdomen, how is the abdominal examination, whether it is soft or not, or any rigidity is present or not, whether there is any tenderness present, and if it is present, in which area it is present, etc. etc. And any focal neurological deficit is there or not, we need to examine. Then musculoskeletal, it is more important in case of, let's say for example, thyroid swelling, breast lump, etc. etc. In case of any malignancies. So to rule out mainly bony metastasis. Okay, so it is very important to check for the musculoskeletal examination, right? Next. So at last, you need to come with all the positive things and ruling out the negative things in your hand. Provisional diagnosis should be written. Actually, there will be certain components in provisional diagnosis. It depends on the case. Here I have given example for thyroid. So for thyroid, how we can write the provisional diagnosis? Means there are three important components. One is anatomical, functional, and pathological. Anatomical means there are two important things you need to understand. So whether it is multinodular goiter or solitary thyroid nodule, obviously the third one will be any diffuse goiter is there or not. Functional means you know that thyroid is a endocrine gland, so it has got some function. So whenever there is decrease in hormone levels, it will lead to hypothyroidism. Whenever there is increase in hormone level, it will lead to hyperthyroidism. So we need to document whether the patient is in euthyroid or whether there is any functional disturbance present. Then based on the clinical presentation, we will be assessing whether it is probably a benign condition or probably a malignant condition. Okay, right. Next, so after the provisional diagnosis, it is management. Please understand, when someone is asking about management of a condition, there are two important things you need to understand. So one is investigations. Second one is treatment. Again, investigations, there are subdivision. So we will be looking in the investigations in the next slide. So for treatment, you can understand, you can remember easily for any condition. First one is conservative, then is medical, then surgical. Okay, then next is others. This others depends upon the condition. Let's say for example, if it's a malignancy, after the surgery is over, you may need to go for adjuvant therapy, etc., etc. So this is the basic pro forma of a management. So whenever we are talking about investigation, you need to understand there are two types of investigations. One is routine investigation, second one is specific investigations. So again, in routine investigations means they are done for each and every inpatient for any major case. So I have given example here for a thyroid case. So I told you it is routine investigations. Second one is specific investigation. Again, in specific investigations, you can easily remember one is laboratory investigation, imaging, then is pathological. So this is the basic pro forma of investigations. So in routine investigations, what are all the routine investigation done? So complete blood picture, blood grouping and typing, bleeding time, clotting time, liver function test, that is total bilirubin, direct bilirubin, indirect bilirubin, etc. Then renal function test, that is nothing but serum creatinine plus blood urea. Then serum electrolytes, random blood sugar, then chest X-ray, PA then ECG. Okay, so these are the basic. Obviously, we must not forget viral screening, triple H, HIV, HYSAG, HCV. So these are the basic viral screening investigations we will be doing. So here I have given example for thyroid. So again in specific investigations, I told you it is lab, imaging, and pathological. So first one is whatever the blood investigations related to the particular case, we can go for those blood investigations. So here in thyroid swelling, you will go for thyroid profile, which includes TSH, T3, T4. Then another one is if it is something like a all both lobes are involved, etc., etc., and you are thinking of malignancy, you can go for serum calcium. Then imaging, nothing but your radiology department. So what are the important specific X-rays that we will be requiring in case of that particular case? Then ultrasound. So please understand, ultrasound is the basic investigation that we will be requiring. In fact, ultrasound is described as extension of our clinical examination, right? Next is your thyroid scan, nothing but your radioactive iodine uptake scan. Then CT and MRI are required only in certain cases, not in all the cases. We will see the details in thyroid case discussion. Then pathological. Please understand, the order should be imaging first, then only pathological. What happens if you do pathological investigations first? It can lead to architectural distortion or anatomical disturbance. So let's say, for example, if the FNSA has been done in the thyroid swelling first, Then you have sent the patient for radiology department to for ultrasound. Because the needle has been poked there can be certain architectural distortion and it may give false positive results. That is why always imaging should be done first, then only pathological investigation. So you know that the basic pathological investigations we have is FNAC, second one is biopsy. It can be, there are different types of biopsy, we will see in different individual cases. Then the other one is video laryngoscopy. It is important mainly for thyroid case again. So it is done by ENT department. So where you need to document the vocal cord status, or sometimes instead of video laryngoscopy, indirect laryngoscopy can also be done. Like this, the investigations you can easily understand. You can divide them into two main headings, and the specific investigations are divided into three subdivisions. Then, according to the case, we will investigate the patient, right? So this is the basic pro forma of a case sheet writing. So after the investigations and all, you will go for treatment. So as I have already told, these are the basic options we have: conservative, medical, surgical, and others. So these others can include, it can be chemotherapy, it can be radiotherapy or hormonal therapy or immune therapy, etc. There are many other subtypes. Okay, so these are the basic other treatment options we have. Okay, right. So this is the basic introduction to case sheet writing. Thank you.